A very good afternoon, my dear friends. A very good afternoon here. This is Dr. Azam here, your faculty of anatomy at PrepLadder here. I hope all of you are doing well. I hope my video and audio is audible. I'm audible to everyone here. Okay, fine. Now it's okay, fine. So, my dear doctors, welcome back here. Now, in this LRR session, we are actually going to do it in like two parts, part 1 and part 2. Of course, in part 1, we are actually going to complete like important topics like neuroanatomy and head and neck and all. And in the part 2, we'll be doing the remaining topics, my dear friends. Fine. Now, to begin with, first of all, in this session of LRR, of course, we are going to deal with all the high-yield topics, very high-yield topics, my dear friends, which are required for your NEET PG, INI-CET, as well as the FMGE exam. So we are going to cover the entire things in detail. Yes, of course. Yes, of course. Even the histology part will also be done here. Fine. Yeah. Yes, medico. Yes, all the concepts will be obviously covered in that one. There's nothing like separately mentioning like FMG. It's only for FMG or something like that. Like all the important topics will be done. Whatever whatever session I'm taking here right now, my dear friends, remember, of course, it will be like high yield and it will be required for your all the exams. Fine, don't worry about that. We don't have to worry about like separate thing for FMG or something like that. Fine. Sure. We'll also cover the histology part also. Fine. NEET PG 2025, how many hours will take for this session, sir? Like we have divided this entire thing into like two sessions, part 1 and part 2, and of course part 1 and part 2 will be approximately for like 2.5 and 2.5 hours. Okay, in total I'm planning to cover in a span of like 5 hours. Yes, of course, all the images will be covered here. Fine. Now, without any further ado, let's get started with the first topic, that is neuroanatomy. And you all know very well how much important is this topic. And I'll try to revise this in like, as simple manner as possible, my dear friends. Okay. So now to begin with neuroanatomy, first of all, what I will do is I'll start with some simple topics here. Like we are going to discuss a few points regarding the ventricles of the brain as well as the spinal cord, and then we'll move on to the higher topics also, my dear friend. Okay. So first of all, about the ventricles of the brain, every exam we are observing that there is a question asked from here. In this diagram, you're able to see that this is the lateral ventricle here, and this one here will be the third ventricle, and finally this one here will be the fourth ventricle. We know that the lateral ventricles will be located in telencephalon. The lateral ventricles will be located in telencephalon, and the third ventricle will be in diencephalon, and the fourth ventricle will be actually in the rhombencephalon. The third lateral ventricle is connected to third ventricle with the help of foramen of Monro, and the third ventricle is connected to fourth ventricle with the help of aqueduct of Sylvius, which is also referred to as cerebral aqueduct. Fine. Now, once you are done with this one, now my dear friends, remember about the lateral ventricle. Lateral ventricle is the one which will be having, this is the anterior horn here, and this one is the central part of this one here, and this is the posterior horn, and finally this one here will be the inferior horn here. So the lateral ventricle will be having like 4 horns. There will be one anterior horn, and then the posterior horn, then the central part as well as the inferior horn, guys. Fine. Now mostly what we have to do is we have to actually learn the relations of these ventricles here. Fine. So let me draw the lateral ventricle separately here. We have to learn the relations of all these ventricles. I'll teach you the relations of the lateral ventricle, the third ventricle, and the fourth ventricle separately over here, my dear friends. But first, let me tell you an important clinical correlation here. Now, suppose if there is aqueductal stenosis, if there is a narrowing of the aqueduct, then what is going to happen? Of course, the CSF will not be moving from third ventricle to fourth ventricle. So therefore, there will be accumulation of CSF in the third ventricle. And which ventricle is getting enlarged here? Of course, the third ventricle will get enlarged here, my dear friend. Okay. So whenever there will be aqueductal stenosis, there is a block in the aqueduct of Sylvius, then it will lead to dilatation of which ventricle here? It will lead to dilatation of the third ventricle here. it will lead to dilatation of the third ventricle. Fine. And remember, the congenital aqueductal stenosis is the most common cause of, yes, congenital hydrocephalus, the most common cause of congenital hydrocephalus. Now, similarly, my dear friends, if there is a block in the foramen of Lashka and foramen of Magendie, the foramens which you will be finding in the fourth ventricle, there will be two foramens on the lateral side, foramen of Lashka, one foramen in the midline, that is foramen of Magendie. If there is atresia of those foramen, what is going to happen? There will be accumulation of fluid in the fourth ventricle. Now, normally in this diagram, you can see this one here will be the fourth ventricle here. Now, if it is enlarged, then this is how it looks like, and this happens in the Dandy-Walker syndrome. So, atresia of the foramen of Lashka and foramen of Magendie, that will lead to dilatation of which ventricle? Yes, it's easy to remember now. It will be the fourth ventricle here, my friends. So, I hope from here you can understand there is no need of mugging up here. In aqueductal stenosis, it will lead to dilatation of third ventricle, whereas in Dandy-Walker syndrome, it will lead to dilatation of the fourth ventricle here. Fine. Now, after completing this like simple things, one more small topic, but very important one, that is your spinal cord. And in spinal cord, you just have to remember like 2 points here. One is about the extent of the spinal cord. Now, we know that in the adults, spinal cord is going to extend from C1 to L1, and L1, which border here, my dear friends, that is the lower border of L1. And then in the infants, it will be from C1 to L3, and that to upper border of L3 here. Extent of spinal cord is very much important. It is always asked every now and then in your exams. Now, similarly, the ending part of the spinal cord is also very much important, my dear friend. Welcome here. Now, this ending part here will be actually a cone-shaped structure, and this is known as the conus medullaris. Spinal cord is going to end in a cone-shaped structure, that is conus medullaris. And now, from the tip of the conus medullaris, there will be a fine thread-like structure, and that thread-like structure will be referred to as phylum terminal. Fine. But what is this phylum terminal here? We know that the spinal cord will be covered by 3 meninges here. Out of them, the innermost meninge will be the pia mater. And pia mater will be closely attached to the spinal cord here. You can clearly see here. It is closely attached to the spinal cord here. But at the ending part, what is happening here? Is it stopping there only? No, it's not stopping there. That is going to further continue down. And that continuation of the pia mater itself is phylum terminal. So please remember that phylum terminal is actually the modification of pia mater. One thing is very clear. Now, if this is like pia mater, then where do we have the arachnoid matter and the dura mater? So remember, the arachnoid and dura mater is going to descend down and finally meet with the pia mater. The arachnoid and dura mater is going to descend down and meet with the pia mater, and it is going to further move down. So now in your exams, they are asking at which point is exactly merging with the pia mater there. Yes, at the level of S2, that to the lower border of S2, Now we can clearly understand from here, so spinal cord is ending at the level of L1, whereas the subarachnoid space, this subarachnoid space is actually ending at the level of S2. So therefore, in between them, you'll be able to do the lumbar puncture. Fine. So one more point that you have to learn here is that the subarachnoid space ends at the level of lower border of S2 here. And then lumbar puncture can be done between L3 and L4. That is more better answer when compared to L4 and L5. So lumbar puncture is most commonly done between L3 and L4. That is more better answer when compared to L4 and L5. I hope this is perfectly done. So about the spinal cord, my dear doctors, if you remember this, that is more than enough for your exams. You have to just remember like 2 things here. Number 1, the extent of the spinal cord. Another thing is ending part of the spinal cord here. Now, just now I told you one of the modification of pia mater here. Fine. I told you about the phylum terminal. Now let us see the other modifications also. Fine. Now, number 1, I told you at the end of the spinal cord, the extension of the pia mater is referred to as phylum terminal. Second modification is linea splendens, and linea splendens is nothing but the extension of the pia mater into the anterior median fissure. So if the pia mater extends into the anterior median fissure, that extension is referred to as what? Linea splendens. Then apart from that, this ligamentum denticulatum is very much important. On either side here, on either side of the spinal cord, you'll be able to see the tooth-like projections here of the pia mater, and those tooth-like projections of the pia mater are referred to as ligamentum denticulatum. Now the question in the exam here is, how many ligamentum denticulatum do you have? Please remember very clearly, there are only 2 of them. One is on the right side, the another one is actually on the left side here, sir. So there will be only 2 of them. One is on the right, another one is on the left there. But remember, these 2 will be with 21 projections on each side. 21 projections on each side, sir. Please don't answer there, as there will be like 21 ligamentum denticulatum. There are only 2 ligamentum denticulatum, but they are with like 21 projections on each side. There will be 21 on one side and there will be like 21 on the other side. So there will be totally like 42 to 44, ligamentum, projections of the ligamentum denticulatum. So there will be only 2 ligamentum denticulatum, one on the right and left, with 21 projections on each side, sir. Now, once we are done with the modification of the parameter, yes, of course, the next thing that we have to learn is about the sections of the brain. But before going about the sections of the brain, let me tell you one important thing about the relations of this ventricle here, the lateral ventricle. I told you in the lateral ventricle, we are actually having like 4 parts here. Let me draw it separately over here. Now, if this one here will be the lateral ventricle, if this is the lateral ventricle over here, now this one here will be the anterior horn, the central part, and then this one is the posterior horn, and this is the inferior horn of the lateral ventricle, sir. The anterior horn, the posterior horn, the inferior horn, and the central part here. And now, my dear friends, remember my simple one small diagram here, that inside this one here, you'll be able to appreciate a nucleus, and this nucleus here will be the caudate nucleus. This is the caudate nucleus here. And just surrounding this ventricle here, you'll be having the corpus callosum here. We know that corpus callosum will be having like 4 parts: the rostrum, genu, the rostrum and the genu and the body and the splenium part. Surrounding that, you'll be having the corpus callosum part here. Now, if you just remember my simple diagram here, if you just remember this simple diagram here, my dear friends, yes, you can easily tell the relations now. Now, this one is here is the anterior horn here. Now, what do you have above the anterior horn here? Above it will be corpus callosum, and what do you have below here? Below it will be caudate nucleus. So the roof of the anterior horn will be formed by corpus callosum, and the floor is actually formed by the caudate nucleus. Now, similarly about the inferior horn here, what is forming the roof of the inferior horn here? That is formed by caudate nucleus, and below here there will be the hippocampus. Below here you will be having the hippocampus here. Fine. So therefore, my dear friends, with this simple diagram, we are actually done with the relations of this anterior horn as well as the inferior horn here. And now welcome to the posterior horn, which was actually asked in your exam, sir, about the posterior horn now. Fine. Now, please look at this diagram. Now, in this diagram, first try to identify this one here will be the posterior horn. We have taken a section of that one, that is your posterior horn. Now, in this diagram, you are able to appreciate very clearly here the roof and the lateral wall. The roof and the lateral wall of the posterior horn will be formed by tapetum fibers. The roof and the lateral wall will be formed by the tapetum fibers. The fibers is nothing but tapetum fiber. They are going to form the roof as well as the lateral wall also. Now the important thing is about the medial wall. Now, on the medial wall, you'll be able to appreciate one, elevation here, and this elevation will be known as the bulb of the posterior horn here. And then you'll be able to appreciate like one more elevation here, and this is referred to as the calcar avis. Calcar avis. And you got to remember the reason for this one. What is the reason for the formation of these 2 elevations here? Now, please remember the bulb of the posterior horn, it will be actually formed by the fibers of forceps major. The fibers of forceps major. Whereas the calcar avis is actually formed by this sulcus here, and this sulcus will be the calcarine sulcus. That is your calcarine sulcus. And the one which is actually asked in your exam was about the bulb of the posterior horn. So remember, the bulb of the posterior horn will be formed by the fibers of forceps major. Forceps major, my dear friends. So in this manner, with the help of like these 2 simple diagrams here, we are able to learn the relations of these ventricles over here. Now all my dear doctors who are listening to me right now, please listen very carefully here that whenever you're writing the exam, whatever exam you're writing, whether it is NEET PG, INI-CET or FMGE exam, the sections of the brain is very, very much important. Okay, so the coronal section and the cerebral section and the transverse section. The coronal section and the cerebral section and the transverse section, all the 3 sections are very, very much important, my dear friends. Why? Because yes, in every exam, remember, the exam will not be completed without the section of the brain. मतलब definitely आपके एग्जाम में ना section of brain से एक सवाल पक्का आता है, definitely आता है आपके एग्जाम्स में, ठीक है ना. Dr. Mask Man is telling, sir, didn't taught this in FMG class. Yes, of course, my dear friends, there'll be a lot of updates every session. So you have to actually keep on updating yourself. Now let us go ahead with the next one here, the coronal section. Now, the first thing that we are going to learn right now is the coronal section. And in the coronal section, we are also going to simultaneously learn about the lateral ventricles also. I hope the moment you look at this diagram here, you're able to appreciate here, this is the lateral ventricle here and lateral ventricle on the other side. And these two lateral ventricles are going to open into the third ventricle, or we can say they're connected to the third ventricle with the help of foramen of Monro. Foramen of Monro. Now, the first thing that you have to learn here is the right and left half of the brain are connected by this bundle of fibers here. The right and left half of the brain are connected by this bundle of fibers here. We have learned in the basics very clearly that anything which is connecting the right and left half of the brain, those white matter fibers are referred to as your commissural fibers. And this one here will be the largest commissure, and this one will be the corpus callosum. Corpus callosum. And this corpus callosum is the one which is going to form the roof of the lateral ventricle. It is going to form the roof of the lateral ventricle. Fine. Corpus callosum is going to form the roof of the lateral ventricle. Now, between the two lateral ventricles, you'll be able to appreciate one septum in the middle here, and this septum will be referred to as septum pellucidum. There will be a translucent septum in the middle, that is septum pellucidum. Fine. And this septum pellucidum is the one which is going to form the medial wall of the lateral ventricle. Wow. So simultaneously in the coronal section, we are also dealing with what here? We are dealing with the boundaries of the lateral ventricle. So we are done with the roof, we are done with the medial wall. The medial wall is actually formed by what? Septum pellucidum over here. And now, my dear friends, after completing the roof here and then the medial wall, now let us learn about the floor of the lateral ventricle. Let's see the floor of the lateral ventricle here. Now, in this diagram, appreciate very clearly here. This nucleus that you are able to see here, this nucleus here will be the caudate nucleus. So this one here will be the caudate nucleus. Perfect. And after this caudate nucleus, you're able to appreciate one small vein here. That vein here will be the thalamostriate vein. This vein here will be the thalamostriate vein. Thalamostriate vein, sir. Fine. And after that, you'll be able to appreciate like there'll be a gray matter present over here. And that one here will be your thalamus. After this thalamostriate vein, you're able to appreciate here. This one here will be the thalamus here. And then, yes, of course, this one which is attached to the lower border of the septum pellucidum here, this one is very, very much important, my dear friends. That is your fornix. So this one here will be the fornix here. And finally, you'll be able to appreciate the, yes, capillaries over here. There will be network of capillaries, and this network of capillaries here will be the choroid plexus. इसको हम choroid plexus कहते हैं sir. And all this together they are going to form the floor of the lateral ventricle. They are going to form what here? The floor of the lateral ventricle, my dear friends. Okay. So the caudate nucleus, the thalamostriate vein, and the thalamus and the fornix, as well as the choroid plexus, all together they are going to form what here? All of them are going to form the floor of the lateral ventricle here. They are forming the floor, sir. So in this manner, if you'll just look at this diagram here, my dear friends, you'll be able to appreciate all the structures. Simultaneously, you are done with the coronal section, as well as, please remember, we are also done with what here? The boundaries of the lateral ventricle. The boundaries of the lateral ventricle. So let me repeat the boundaries once more here. Let us revise together, my dear friends. What is going to form the roof of the lateral ventricle? The roof of the lateral ventricle is formed by corpus callosum. The medial wall will be formed by septum pellucidum, and then the floor here, the floor will be actually formed by the caudate nucleus, the thalamostriate vein, the thalamus, as well as the fornix and the choroid plexus. Now, once you know all these structures here, that's all. You are actually done with the coronal section. Remaining things you can easily manage. Now, for example, just now I said you that this one here will be the caudate nucleus here. Fine. This one here will be the thalamus here. Perfect. And then, of course, there will be the lens-shaped nucleus, that is your lentiform nucleus here. So this lens-shaped nucleus here will be the lentiform nucleus. Now, once in your FMG exam, my dear friend, they have put an arrow mark here and they have asked this nucleus. What is that nucleus? लेंटिफॉर्म न्यूक्लियस. तो इसलिए मैंने आपको क्लियरली कहा था कि आपके एग्जाम में ना सेक्शंस ऑफ ब्रेन बहुत बारी दिया जाता है. मेनी अ टाइम्स द सेक्शन ऑफ ब्रेन विल बी एक्चुअली गिवन टू यू. So your exam will not be completed without a section of brain. Clear? So that is your lentiform nucleus. Recently in the FMG exam, they have again given this coronal section. There was arrow mark here and you have to identify. That is your internal capsule. So this white matter fibers which are actually passing from here, this one here will be the internal capsule here, sir. So this will be the lentiform nucleus here and this is the internal capsule here. Fine. तो ये दोनों भी सवाल आपके FMG एग्जाम में दिए गए थे. Someone was asking in the chat box there, in the comment section there, someone was asking there, my dear friend, please specify the questions regarding FMG also, sir, separately. Yes, you can see I'm covering all of them. Fine. So in the middle, you will be able to find this white matter fiber here. This is your internal capsule. Recently, that was asked in the exam. And in one of the PG exam, the arrow mark was actually here. This one. Can you identify what is that black colored pigmented substance here? Can you identify what is that black colored pigmented substance there? Dr. Pavan, this session is for NEET PG, INI-CET as well as for FMG. We are doing the LRR session here for like all the exams that you're doing. I'm covering all the high topics in that one. If I have specified like 2 questions which are asked in FMG exam, it doesn't mean that it is only for FMG. Okay. Yes. Yes, very good, Dr. Divya there. Substantia nigra, very fine, very good. Fine. This one here will be the substantia nigra here. That was asked in the PG exam. ये PG exam में पूछा गया था. Clear? Perfect. Sir, there is no difference now in any exam, just the label is different. Completely agree with that. Completely agree with that one. Now, shall we go ahead? Now, for my dear friends, if you know all the structures here, now that's all. Let it be any exam. If you know these many structures which are there on the screen right now, let it be any exam. My students are ready now. Okay, ready with the coronal section of this one here. Nowadays, the phonics part is very much important. Phonics topic is very much important here. And they're asking many questions about the phonics here. So let me tell you all the points regarding the phonics. Please read this question here. The structure indicated in the given image originates from where? See, the structure in the given image here, yes, I think all my students will be able to identify nowadays phonics. Yes, you're able to identify this one here. It is phonics. But the question is that it is going to originate from where? Yes, of course, the answer is hippocampus. It is going to begin from hippocampus. That structure is phonics, fine, but it is going to originate from where? It is going to begin from hippocampus. Let me show you that picture here. Now in this diagram, you can clearly see here, this one will be the hippocampus, and from the hippocampus, there will be phonics going all the way up to the mammillary body. It is going up to the mammillary body, and from the mammillary body, there will be a separate tract here, mammillothalamic tract, and that is going to carry the information up to the thalamus. Which nucleus of thalamus? That is the anterior nucleus of thalamus. So from the hippocampus to mammillary body, the information will be actually carried by the phonics. And then from the mammillary body to the anterior nucleus of thalamus, that is by mammillothalamic tract. Mammillothalamic tract, sir. Are you understanding me? Now in this one sentence, many a times the question has been answered. Fine. Phonics begins from where? Hippocampus. Phonics is going to where? Mammillary body. 2 questions already asked in your exam. And then the mammillothalamic tract is going to end in which nucleus of thalamus? Anterior nucleus of thalamus. ये भी आपके एग्जाम में पूछा गया था. In the one of the PG exam they have asked that here. So please remember that one line is like multiple questions there. So many times the question has been asked from there, sir. Chaliye. Now phonics belongs to which types of fiber? Next question. Now I hope you all remember about the white matter. The white matter is actually divided into 3 categories: association, commissural, and projection fibers, sir. Fine. The fibers which are going to connect antero-posteriorly will be association fiber, आगे पीछे. The fibers connecting the right and left half will be the commissural fibers, and then up and down you'll be having the projection fibers here. Fine. So antero-posteriorly you'll be having association fiber, then commissural, and then projection fiber. Now, my dear friends, fornix belongs to which type of fiber? Remember, it belongs to all the three categories: association, commissural, and projection. Fornix belongs to all the three types of fibers: association fiber, commissural fiber, and projection fiber. So in the options, if they are given all of the above, mark all of the above. Now, out of this, if you want one specific answer here, please remember it is association better than commissure better than projection. Second question solved here. Third question is, recently in one of the exams they have given a combination, my dear friend. Remember, it is association and commissure more better combination when compared to association projection when compared to commissure and projection fiber. So all the questions regarding fornix are solved here, sir. I repeat once more here. Remember, fornix belongs to fornix belongs to all the three categories of fibers, sir: association, commissural, and projection fibers. Perfectly done. And then association is better than commissure, better than projection fiber. Okay, अगर आपको इनमें से चूज करना है, सेलेक्ट करना है, तो association is a better fiber. But recently in your exam they have asked the combination. So please remember, fornix belongs to association and commissural fiber. That is the best combination when compared to any other thing. Fine. Next one, fornix on either side, on both the sides the fornix will be connected. I told you, right and left side, it will be always connected by commissure. And please remember, the fornix on either side is connected by hippocampal commissure. Fornix on either side is connected by hippocampal commissure. Hippocampal commissure, sir. Fine. So in this manner, my dear friends, on this slide here, we have completed each and every question regarding the fornix. Each and every MCQ I have actually bought at one place here, whether it is asked in NEET PG, INI-CET or FMGE exams. Everything regarding the fornix is done over here. Next one, next concept here. Now, as I told you, we are going to deal with all the sections of the brain here, like the coronal section, the sagittal section, as well as the transverse section. Okay, na? Fine. now we are going to deal with the sagittal section here, sir. Now in the sagittal section here, you can clearly see this one here will be the third ventricle here. First, you try to identify the third ventricle here. Fine. Now, if this is the third ventricle over here, yes, of course, this one here will be the fourth ventricle, and they are connected by a duct here, that is the aqueduct of Sylvius or cerebral aqueduct, sir. Now, first of all, third ventricle कहाँ होता है? Third ventricle is actually between the thalamus and hypothalamus on either side, sir. So therefore, in this diagram, you're able to appreciate here, this is the thalamus part here, and below the thalamus, this one here will be the hypothalamus part here. So thalamus and hypothalamus, they are going to form the lateral wall of the third ventricle. Thalamus and hypothalamus, that is going to form the lateral walls, lateral wall. Now, once you are done with the lateral wall, what is forming? The roof here. The roof of the third ventricle will be formed by, yes, this one here will be the choroid plexus, the network of capillaries. Above this choroid plexus here, this one here will be the fornix. The fornix and choroid plexus, these two are going to form the roof of the third ventricle. The roof of the third ventricle. Fine. The fornix and the choroid plexus, they are going to form the roof of the third ventricle. Then now in the front here, you'll be able to appreciate one commissure here. This one is anterior commissure, and this lamina here will be referred to as lamina terminalis. So this one here will be the anterior commissure, and this lamina here will be the lamina terminalis. Lamina terminalis, and these two are going to form anterior wall of the third ventricle. These two are going to form the anterior wall of the third ventricle. Fine. Yes. Now here itself, I want you to remember like 2 points regarding lamina terminalis here. Yes, my dear friends, you can actually note down. I'm not writing here. What is lamina terminalis actually representing? Remember, it is the remnant of the anterior neuropore. Lamina terminalis is representing the remnant of anterior neuropore. It is a remnant of the anterior neuropore. I hope you all have learned in embryology, there will be neural tube, and neural tube has got like 2 pores. One will be the anterior neuropore, another one is the posterior neuropore. Out of these 2 neuropores, remember, anterior neuropore जो होता है उसका जो remnant होता है, remnant of the anterior neuropore will be the lamina terminalis. Lamina terminalis. And number 2, second point that you have to remember, this is the place where you don't find any, yes, blood-brain barrier. There will be no blood-brain barrier at the lamina terminalis, and that is why it is considered to be one of the circumventricular organ. All the organs where you don't find any blood-brain barrier, that is referred to as circumventricular organ, sir. Circumventricular organ, guys. Okay. Now what about the posterior one here? Posterior wall is formed by what here, guys? First, you need to identify this gland here. This gland here will be the pineal gland. And above the pineal gland, there will be one commissure, and this commissure here will be the hippocampal commissure. And below the pineal gland, there will be one commissure, and that commissure will be the posterior commissure, sir. And then, of course, this duct here will be the aqueduct of Sylvius. And all this together, they are going to form what here? They are going to form the posterior wall of the third ventricle. Posterior wall of the third ventricle here. Are you understanding me here? The anterior wall will be formed by like two structures there. One is anterior commissure and lamina terminalis, and the posterior wall will be formed by the hippocampal commissure, the pineal gland, the posterior commissure, as well as the aqueduct. Please remember, pineal gland के ऊपर वाला जो commissure होता है, above that is hippocampal commissure, and below that will be the posterior commissure. Now, once you are done with all these things here, welcome to the floor of the third ventricle. Now, this crossing here will be referred to as optic chiasma. This crossing here will be the optic chiasma, and this one here will be the infundibulum part here. I'm just writing in short here, my dear friends. So this part here will be the infundibulum part, that is pituitary stalk, and please remember that will be along with tuber cinereum. Infundibulum along with tuber cinereum there. And this body here will be the mammillary body, and this perforated substance here will be the posterior perforated substance, and finally this one here will be the tegmentum part of the midbrain. Yes, already in the regular classes we have discussed, my dear friend, that in the midbrain there will be a duct passing here, and this duct here will be the aqueduct of Sylvius. The structure behind the aqueduct of Sylvius here, this one here will be the tectum part, and the structures in front of that one here, this will be the tegmentum part, sir. So behind the aqueduct there will be tectum part, and in front of that there will be tegmentum part, and all these parts together they are going to form the floor. They are going to form the floor of the third ventricle. So in one diagram, we are actually done with everything over here. Okay. And once we are done with this one here, yes, remaining parts, any student can tell, even the first year MBBS student can tell that. Yes, of course, this one here will be the fourth ventricle, my dear friend. And this, of course, will be your midbrain here. And then followed by this big structure is pons here, then medulla oblongata, and behind here, this one will be the cerebellum part. ये तो कोई भी बताएगा. So just learn whatever structures I have written over there. That's all. You are ready with the skeletal section for any exam. NEET PG, INI-CET or FMGE, any exam. Let them give this diagram. My students are ready right now, sir. Fine. Now, once you are done with this one here, let us go ahead into this diagram here. Yes. In your exams, what they're doing is they're giving you a radiological image like this here, and in that radiological image you have to identify. So just now we are done with the sagittal section over here. Now I think my student can easily identify all the structures in the radiological image also. Now this one here will be the corpus callosum. Just below the corpus callosum, this one here will be the fornix. और अभी भी मैंने आपको बताया है, just now I told you here, this is nothing but infundibulum attached to the pituitary gland below here. And this body here will be the mammillary body, and then the midbrain, pons, medulla oblongata. I hope now it's like a cakewalk for my students. You can easily identify. We can easily identify here. And the students who are asking, after learning in depth, I told you all the structures here in depth here. Fine. But after learning all these things in depth here, my dear friends, in your FMG exam, there was recently this image given, and then the arrow mark was actually here. Here. Yes, my dear friends. After learning all these things in depth here in the class, there was an arrow mark given at this structure. The answer is like pons. Answer pons. That's all you're done. I think now you'll be able to easily answer this type of questions. Fine. That is pons there, guys. है ना? Sir, please give brief idea about where are different structures located in the brainstem. Of course, we'll study about the brainstem later on. We are going to revise that one also. Don't worry. Now, actually, doctors, right now, what is the thing that we are discussing? I hope you are aligned along with me. We are actually discussing about the sections of the brain. So one by one, I'm dealing with all the section. So we are done with coronal section, and now cerebral section is also done here. So now welcome to the transverse section. Now in transverse section, first of all, identifying the orientation is very much important. Sir, please take my doubt too. Sir, in the champions exam, I have actually read your question there that you wrote, but that is totally like deviating from our topic right now. Let us just first of all do like LRR session here, revision here. Okay, you are telling me about some question given in champions exam. Again अपने को पूरा वहाँ पर जाना पड़ेगा, कौन सा सवाल है, कौन सा क्वेश्चन है, आप क्या रिफर कर रहे हो. तो when we are already doing one session here in a flow, that flow will be actually gone. I hope you're understanding. I don't know what is your name, NHB0404. In champions exam, there was a diagram to identify the CN and it has very ambiguous image also. That's what. See, the question also, it is not there. Now you're referring to which question? I don't know. I don't know you are referring to which question exactly. Some question was given, some diagram was given, and it was ambiguous. So my dear friend, please try to understand. We are going in a flow with this one here. That is why मैंने आपका सवाल देखा है. I did not ignore that one, but this is not the right time. You can actually send a screenshot to me. Like you can send me a direct message. I'll respond to you. Okay, I'll send you a voice note. I was revising Biochemistry. Thank you, thank you, thank you. No, nothing to be sorry, my dear friend. ना मैंने देखा है, but अब वो क्वेश्चन कौन सा वाला है? सम क्वेश्चन मतलब अब हमको भी नहीं पता है ना यहाँ पर. या चलो, हाँ जी, कहाँ थे हम? हाँ, ट्रांसफर सेक्शन ऑफ सेरिब्रम हियर. पहले ना इस डायग्राम में ना फर्स्ट ऑफ ऑल ओरिएंटेशन इज वेरी मच इंपॉर्टेंट. Orientation is very much important. Now this one is cerebral hemisphere here. Okay. Now inside the cerebral hemisphere, you'll be having the corpus callosum here, rostrum, genu, body, and the splenium part here. Okay, corpus callosum. And now we are actually taking a section at this level. For example, we are taking a section at this level here. Now when you take a section at this level here, my dear friend, this will be the genu part here. This turning part is genu part here, and genu part right in front here, this is the frontal lobe, fine. And this is the splenium part here, and behind here, this one here will be the occipital lobe. Now you try to understand the orientation here. We are actually taking a transverse section. We are removing the structures from above and then we are seeing from above, fine. Now in this diagram here, this lobe here will be the frontal lobe. And this lobe here will be the occipital lobe here, sir. This is the occipital lobe here. Fine. So we are taking a transverse section here, and then you'll be having the frontal lobe in the front and the occipital lobe behind. And this part here will be the genu part here, and this is the splenium part here, sir. After taking a transverse section, we are seeing from above the genu in the front and the splenium behind. Now this genu is actually connected to the frontal lobe here. With the help of these white matter fibers here, you're able to see. The genu is connected to the frontal lobe here, and these fibers here are referred to as forceps minor. Forceps minor. And similarly, the splenium is connected to the occipital lobe here. And it is connected here to the occipital lobe with the help of these fibers here. And these fibers here will be the forceps major fibers here. Forceps major fibers here, sir. ठीक है ना? Are you understanding me here? The genu part is connecting to the frontal lobe with the help of forceps minor, and the splenium part is connected to the occipital lobe with the help of forceps major. Now the genu and body, they are connected by what here, sir? They are connected by genu and the splenium are connected by what here? The body. Now from the body, the fibers which are moving out will be the tapetum fibers. आगे genu होता है, पीछे splenium होता है. Ahead you will be having the genu, behind you will be having splenium, and they are connected by what? They are connected by, yes, the body. And from the body, there are certain fibers which are going laterally, and those fibers which are going on the lateral side will be the tapetum fibers. What are the fibers? Tapetum fibers. Okay. Now this tapetum fibers will be actually passing from here. You have to identify these are the tapetum fibers here. अगर ये वाले tapetum fibers है, if these are the tapetum fibers, just try to recall कहाँ पर मैंने अभी अभी आपको बताया था. Just now I told you somewhere about the tapetum fibers. They are going to form the roof and lateral wall. The roof and lateral wall of posterior horn. So this is the posterior horn. याद है आपको lateral ventricle? In the lateral ventricle I told you like there are like 4 horns there. Okay, in the lateral ventricle I told you that there will be like 4 horns: anterior horn, the central part, and posterior horn. Posterior horn will be having the roof and the lateral wall that will be formed by what guys? Tapetum. तो यहाँ पर आप देख सकते हो वो tapetum fibers होते हैं, ठीक है ना? Are you understanding? जब भी हमने recall किया था. Now by this we are actually done with what here, sir? We are done with this part here and with this part here, sir. The part in the front here is done. The part behind here is also done. Fine. And now welcome to the middle part here. Let us deal with the middle part here, sir. Fine. Dr. Abdul is writing there. You seems little low in energy. Hope you're fine, sir. No, Dr. Abdul, I'm actually not at all fine. I'm suffering with actually severe, back pain. Severe low back pain from last 1 month, and I have been like in complete bed rest. And this is a session which I'm taking after a long time. Uh, like after the bed rest, I mean to say, after, not even like after the bed rest, in the middle of the bed rest only. So it is troubling me a lot now. I'm not able to sit properly. Yeah, that is what is happening right now. Thank you. So now welcome to the middle part here. In the middle part, this nucleus here will be the caudate nucleus, and this is the thalamus here, and this is the lentiform nucleus here. What is the reason for your back pain, sir? The reason you people know very well, teaching from last 12-13 years, and teaching from last 12-13 years in the same position, sitting, no much physical activity, completely like continuous classes, continuous traveling, not taking much care about the health. So it has happened. It is actually the bulge in the disc. Yes, L2, L3, L3, L4, L4, L5, L5, S1. जिम 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 करना पड़ेगा, है ना? जिम करने के लिए यार वो चाहिए ना, अपने को रेस्ट चाहिए, टाइम चाहिए. हमारी क्लासेस एक्चुअली जो होती है नॉर्मली, जो ऑफलाइन क्लास होती है, मॉर्निंग टू इवनिंग, ना, ऑफलाइन क्लासेस, द स्टूडेंट हु हैव एक्चुअली अटेंडेड माय क्लासेस, दे नो वेरी वेल, लाइक मॉर्निंग टू इवनिंग, 9 to 7, 9 to 8, लाइक दैट, एंड कंटिन्यूसली सिटिंग. तो इसीलिए. हम्म. श्योर. Yeah, I'm trying my really best. Yoga and all these things, physiotherapy and all. Hmm. Yes, hanging bar. Thank you. Sure. Hmm. Inshallah. I'll surely teach your kids also. Now let's see here. Sure. So let me see like till what I can take this session, because it's still paining now. It's all hazy in the front. I'm not able to see properly. Hmm. Morning, today in the morning also, like I've just taken the breakfast. I've done with my breakfast and I've taken medicines. And I was just trying to take the session today somehow, because your exam is there nearby, है ना? तो नीट पीजी एग्जाम है. In May you're having your INI-CET exam, then June you're having NEET PG exam, then in July you'll be having your FMGE exam. Yes, yes, yes. Horse fire tablet, sir. वो क्या होता है भाई? What is that, Lalit? Fine. Let me see how much till how much time I can bear the pain. Chalo. Now, in this diagram, between the caudate nucleus, thalamus, and the lentiform nucleus, this capsule here will be the internal capsule here. In this one here will be the internal capsule here. So fine. That white matter fibers in the middle here, this one here will be the internal capsule. Now, have you ever thought why is this internal capsule known as the internal capsule? कभी आपने सोचा है? Have you ever thought why is this internal capsule known as internal capsule only? Yeah, yes, yes. Forceps minor and forceps major, Saurabh, it is actually white matter fibers only. They are white matter fibers only. They are connecting the this one. Next, why this internal capsule here? Why? Because remember here, this lentiform nucleus is lens shape. Lentiform nucleus is like lens shape, and it is like lens shape having a capsule inside and outside. There is one capsule inside and one capsule outside. Fine. So you can clearly see that there is a thin sheet of white matter here also. Outside the lentiform nucleus, there is a thin sheet of white matter, and this one here will be the external capsule. This one here will be the external capsule. Fine. And then, my dear friend, outside that, one more fine sheath of white matter is visible there. This is nothing but extreme capsule. Extreme capsule. So whatever word I'm writing here as capsule here, yes, my dear friend, whatever word I'm writing here as capsule here, it's nothing but your white matter here. So there is an internal capsule here, and then after that there will be external capsule here, and then you'll be having the extreme capsule here. Now between the external and extreme capsule, yes, between the external and extreme capsule, you'll be able to find a thin sheet of gray matter, and this thin sheet of gray matter here will be the claustrum. इसको हम ना claustrum कहते हैं sir. This will be claustrum, and yes, of course, you'll be also having the hidden lobe here, and that is the insula. There'll be hidden lobe of the cerebrum, that is the insula part. So there'll be thin sheet of gray matter, that is claustrum, and then the hidden lobe of the cerebrum, that is insula. Insula bhi yahan par hota hai, sir. Done. So in the middle part, you have to remember about all these structures here. So in this manner, in the transfer section, we are done with the middle part also. This part is also done here. Fine. Now from here, let us take out the internal capsule outside here. Like many questions are asked regarding the internal capsule. First of all, you have to know about the parts of the internal capsule, sir. In total, how many parts are there in the internal capsule? Please remember there are totally like 5 parts in the internal capsule. One will be the anterior limb, another one is the posterior limb, and then the genu part, and then sublentiform part, and then the retrolentiform part. Okay. So please remember that there will be anterior limb here. This bent here in the middle will be genu, and this is the posterior limb here. And then you'll be having the sublentiform part and the retrolentiform part. So there are totally 5 parts in the internal capsule. Number 2 thing that you have to remember is about the relations of the internal capsule. Yes, you can clearly see on the medial side you'll be having the caudate nucleus here and the thalamus, and then on the lateral side you'll be having the lentiform nucleus. This is the lentiform nucleus. I hope you all know that the lentiform nucleus is made up of 2 parts here. One is your putamen, another one is globus pallidus. Putamen and globus pallidus will be there, but in that also you have to remember that the outer part will be actually the putamen part, and the inner part will be the globus pallidus. Even that was also asked in exam. And yes, my dear friend, please remember that was also asked in the exam. You have to remember that globus pallidus part is towards the medial side there, and the putamen part is on the outer side there. So relations bhi ho gaya, parts bhi ho gaya. Now once you are done with the relations and the parts over here, now my dear friends, welcome to the tracts passing through internal capsule. The tracts passing through the internal capsule, sir. Okay. Number 1, the tract which is going to pass through the genu part here. The tract passing from the genu part here will be the corticonuclear tract. Corticonuclear tract is passing through genu part. Fine. And the tract passing through the posterior limb here will be the corticospinal tract here. So corticospinal tract, I have written below here also. Corticonuclear tract is passing from the genu part. corticonuclear part, it is actually the one passing from the genu part, whereas corticospinal tract is the one which is going to pass from anterior 2/3 of the posterior limb, sir. Anterior 2/3 of the posterior limb. I'll just repeat this once more here. It's worth repeating, very much important. Corticonuclear tract is passing from the genu part here, whereas the corticospinal tract is going to pass from the anterior 2/3 of the posterior limb, sir. Anterior 2/3 of the posterior limb. So this is like very, very much important. You got to remember here. Now, once you are done with these points here, welcome here to the blood supply of internal capsule. And the diagram on the screen is absolutely the best diagram to learn about the blood supply of the internal capsule here. Again, you can appreciate the same thing. The parts of the internal capsule, that is your anterior limb, the genu part, the posterior limb, the retrolentiform part, along with the sublentiform part. Fine. Now, in the anterior limb, genu and the posterior limb, we are again going to divide them into upper part, that is superior part and the inferior part, sir. Superior part and inferior part. So please remember here, the superior part of the anterior limb, genu and the posterior limb. Superior part of the anterior limb, genu and the posterior limb will be supplied by the striate branches of the middle cerebral artery, MCA. Striate branches of the middle cerebral artery, superior part. Now the inferior part of the anterior limb only, that will be supplied by recurrent branch of anterior cerebral artery. Recurrent branch of anterior cerebral artery, sir, ACA, fine. And this recurrent branch, yes, and this recurrent branch here of the anterior cerebral artery, that is also referred to as Huebner's artery. इसको ना Huebner's artery भी कहा जाता है सर. Okay ना, Huebner's artery भी कहा जाता है. ठीक है? Now apart from that, remember, inferior part of the genu here, it is actually supplied by, yes, direct branches coming from internal carotid artery. The branches from internal carotid artery, and remaining everything which is highlighted here in green color, I mean to say, inferior part of the posterior limb, retrolentiform part, sublentiform part, all of them are taken care by anterior choroidal artery. Anterior choroidal artery, sir. Fine. So in this manner, you have to actually learn about the blood supply of the internal capsule is very, very much important there, guys. Okay. In this manner, internal capsule topic is also done. So my dear doctors, by this, if you're observing there, we are done with all the three sections of the brain. That is the coronal section, the transverse section and the sagittal section. All the sections are done. Along with the sections of the brain, we are also done with what here? We're also done with like many topics associated with that one. Like fornix is done, internal capsule is done, all the basal ganglia, all the gray matter part is done and all. Fine. Now in the recent exam, my dear friend, remember about the basal ganglia, they're asking about the lesions of the basal ganglia. You know the parts of the basal ganglia very well, the corpus striatum, chordate nucleus, lentiform nucleus and all. Yes, the lesions are important here. If there is a lesion in globus pallidus part, it will lead to athetosis. If there is a lesion in globus pallidus, it will lead to athetosis. Similarly, if there is a lesion in podamen and chordate nucleus, it will lead to what, guys? Chorea. In your exam, it was asked in a reverse manner. Chorea is due to the involvement of which structure here? The podamen and the chordate nucleus. Parkinson's disease, ये तो आप सबको अच्छे से पता है. Yes, it will be due to involvement of which structure? Substantia nigra. And then finally, my dear friend, remember, सबथैलेमिक न्यूक्लियस अगर इन्वॉल्व होगा तो इट लीड टू व्हाट गाइस? हेमीबैलिस्मस होगा यहाँ पर. ठीक है ना? क्या होगा? हेमीबैलिस्मस. Is it clear? Fine here. Now, once you are done with the lesions in the basal ganglia, yes, these two questions were already asked in the exam. Chorea, which structures are involved? Podamen and chordate nucleus. And hemibalismus, recently asked, which part is involved? Subthalamic nucleus part is involved. This question has been asked in your exam, sir. अब चलिए आगे बढ़ते हैं. After completing about the sections of the brain, the next thing that we are going to learn is about the brain stem now. Brain stem, that is midbrain and the pons and medulla oblongata. तो midbrain, pons and medulla oblongata together they are going to form the brain stem. चलिए हम लोग ना ब्रेन स्टेम के बारे में स्टडी करते हैं. I'll teach you about the ventral aspect of brain stem, dorsal aspect of brain stem as well as the transverse section, and then we'll also see the brain stem syndromes also if possible. Fine. First of all, in this diagram, we are able to see the ventral aspect of the brainstem. Now, in the ventral aspect of the brainstem, yes, my dear friends, in the ventral aspect of the brainstem, you are able to see that there will be, yes, the cranial nerves going to begin from here, sir. The cranial nerves are going to begin from here. Fine. So this one here will be the third nerve and this one here will be the fourth nerve. The third and fourth nerve are going to begin from midbrain. Third and fourth nerve is going to begin from where? From the midbrain. And then fifth nerve is coming out from the pons. So this big structure here will be the pons. And the fifth nerve, trigeminal nerve, is going to come out from the pons. Or to be more specific, we can say that it is coming out at the junction of pons and middle cerebellar peduncle. The peduncle which is connecting the pons to the cerebellum there, middle cerebellar peduncle, it is coming out from there. Now the sixth nerve here and this one here is the seventh nerve and this one here will be the eighth nerve. The sixth, seventh and eighth nerve is going to come out between the pons and middle oblongata, pontomedullary junction. Pontomedullary junction. And then when it comes to middle oblongata here, there is an elevation here known as pyramid and pyramid here. And this elevation here will be the olive and olive here. Now just lateral to olive here will be the 9th nerve and the 10th nerve and the 11th nerve. And between the pyramid and olive, this will be the 12th nerve. Sir. Fine. So 9th, 10th and 11th nerve is going to come out, exit out lateral to is it okay? Lateral to olive. And then the 12th nerve is going to come out between the pyramid and olive. Sir. Fine. So let us have a quick revision over here. My dear friend, the third and fourth nerve is going to come out from the midbrain. The fifth nerve is going to come out from the at the junction of pons and the middle cerebellar peduncle. And then the sixth, seventh and eighth nerve is going to come out at the pontomedullary junction. And then 9th, 10th and 11th nerve is coming out lateral to olive. And the 12th nerve is coming out between the pyramid and olive. Sir. Okay. Now one point, let me tell you here itself. 9th, 10th and 11th nerve, they will be having a common nucleus and that nucleus will be referred to as nucleus ambiguous. Nucleus ambiguous कहते हैं सर इसको, ठीक है ना? Now here itself, let me tell you a few points regarding the fourth nerve. Remember, fourth nerve is the thinnest cranial nerve. Out of all the cranial nerve, it is the thinnest one. Not only thinnest, it is the smallest cranial nerve. Sir. Now the most important point is, it is the only cranial nerve having dorsal origin. Very much important. Multiple times you have asked in the exam in some or the other different way. Okay. So fourth nerve is the one which is having dorsal origin. And because it is having dorsal origin, it's going to take a turn and come in the front. So it will be having the longest intracranial course. Longest intracranial course. It will be having the longest intracranial course. And then, my dear friend, remember one last and final point, that it is also having internal decussation. Now, what is the meaning of decussation in neuroanatomy? Remember, decussation का मतलब होता है crossing. Decussation means what, sir? Decussation means what, guys? It is actually crossing here. And internal decussation means what, guys? The crossing inside the midbrain. So remember, the fourth nerve, the trochlear nerve, actually has got the internal decussation, guys. So all these 5 points you have to remember. Let me repeat the 5 points again. Number one, fourth nerve, it is actually the thinnest one and the smallest one. And then it is actually having the dorsal origin. Then it is going to take a turn and come in the front. That is why it is having the longest intracranial course. And then yes, of course, it is also having internal decussation. Internal decussation here. Okay. Next one. Apart from that, in this diagram, you're able to see here, this one here will be the cerebral peduncle on one side and this is the cerebral peduncle on the other side. Between the two peduncles here, you'll be able to find interpeduncular fossa. Now, what are the contents of interpeduncular fossa here, sir? Now, what are the contents of interpeduncular fossa? Number one, this one here will be the infundibulum. Along with the infundibulum, there will be tuber cinereum. Okay, and then after that, this one here will be the mammillary body and this one here will be the mammillary body. And then after that, there will be the posterior perforated substance here, sir. There will be perforations here, that is known as the posterior perforated substance. And finally here, this will be the cranial nerve number 3, the third cranial nerve, sir. So what are the 4 contents of interpeduncular fossa? That will be the infundibulum along with tuber cinereum. infundibulum and tuber cinereum, and then the mammillary body, and then the posterior perforated substance, and then the cranial nerve number 3. All this will be the contents of your interpeduncular fossa. Is it okay? This topic is also completed over here, sir. Fine. Now I will tell you one important clinical correlation here, my dear friends. Now, what is the clinical correlation here? Please look here. If there is an injury at this location, then what is going to happen? This question was given in the INI-CET exam. If there is an injury here, then what is going to happen? Fine. I just now told you that this elevation here will be the pyramid. This elevation here will be the pyramid. And then this elevation here, this one here will be the olive. Fine. Now you should also know what is the reason for this elevation, why it is elevated. Remember, olive is elevated due to the inferior olivary nucleus. If you see just beneath the olive, if there will be a, okay, if there is an olive there, just beneath the olive, there will be inferior olivary nucleus. Because of that one, it will be, yes, elevated, that is known as olive. And then pyramid is actually elevated due to the tract here, and that tract will be the pyramidal tract, sir. Fine. So olive is elevated due to the inferior olivary nucleus, whereas the pyramid will be elevated due to the pyramidal tract, and the arrow mark is actually there at the pyramid. और अगर यहाँ पर injury अगर होगा, if there is an injury here, then what is going to happen? अगर यहाँ पर injury होगा तो क्या होगा? Of course, it is due to pyramidal tract, and pyramidal tract is ascending tract or descending tract, sir? Remember, pyramidal tract is a descending tract, descending motor. And one more important thing, if you can appreciate in the diagram here, that pyramidal tract is going to descend down, descend down, descend down, and majority of the fibers are going to cross here, sir. And that crossing will be referred to as pyramidal decussation. So this crossing here of the pyramidal tract fibers is referred to as pyramidal decussation. And this question has been asked in your exams a lot of times, that where exactly pyramidal decussation is taking place. Remember, it is taking place at lower medulla. Yes, pyramidal decussation will be taking place at lower medulla. This has been asked multiple times in your exams. Sir. Pyramidal decussation is taking place in lower medulla. Now listen to me very carefully. I'll tell you a little slowly here. Listen to me very carefully here. If the injury occurs to pyramidal tract before decussation, then what is going to happen? And if the injury occurs to pyramidal tract after the decussation, then what is going to happen? After decussation. So whenever in your exams, they are going to ask you the question about injury to pyramidal tract. Yes, my dear doctors, what you're going to think? You're going to think about the decussation. ठीक है ना? कि decussation से पहले injury होगा तो क्या होगा, और decussation के बाद होगा तो क्या होगा? So if the injury is before the decussation here, then what is going to happen? Yes, opposite side muscles will be paralyzed, sir. है ना? If the injury is like before the decussation, then what is going to happen? It will lead to contralateral hemiplegia. Very good, very good. And if the injury is after the decussation, it will lead to what, guys? Ipsilateral hemiplegia. Okay, समझ में आ रहा है कैसे डील करना है? How to deal with this question here? So if there is an injury to the pyramidal tract before decussation, it will lead to contralateral hemiplegia. Yes, before decussation, it will lead to what, guys? Contralateral hemiplegia. And if the injury is like after decussation, it will lead to what, guys? Yes, ipsilateral hemiplegia. That is how you have to actually deal with this type of question here. Done. So once you are done with this one here, yes, now welcome to the dorsal aspect of the brainstem. Now we are done with the ventral aspect, and along with the ventral aspect, you are seeing simultaneously in every topic I am dealing with what, sir? All the questions which has been asked in your exam. तो आप जो पूछ रहे थे ना मुझे स्टार्टिंग में कि सर क्वेश्चंस भी कवर करेंगे, yes of course, simultaneously we are dealing with the questions also here, sir. Fine. Okay. Are you all understanding me? Following me? Now, dorsal aspect of the brainstem here, sir. Now, in the dorsal aspect of the brainstem behind the midbrain, Behind the midbrain, there'll be superior colliculus, and there'll be inferior colliculus and inferior colliculus. And all these four bodies here, that is going to form your corpora quadrigemina. Corpora quadrigemina. Okay. There'll be two superior colliculi and there'll be two inferior colliculi, sir. Fine. There'll be two superior colliculi and there'll be two inferior colliculi. Together, they're going to form like four bodies, and those four bodies are corpora quadrigemina. Fine. Now let me see how much active you are, my dear friends. How much active you are. Can you please identify this nerve here? Can you please identify this nerve here, sir? Very nice, very good, absolutely correct. मैंने आपको अभी भी बताया था, the only cranial nerve which is having dorsal origin will be the fourth nerve, and fourth nerve will be having dorsal origin coming out from the midbrain, sir. Fine. चलिए next one. Now behind the pons and medulla oblongata, this elevation here will be the facial colliculus, and then this elevation here will be the vestibular area, and this elevation here will be the hypoglossal triangle, and then finally here this one will be the vagal triangle, sir. Hypoglossal triangle and then vagal triangle. And in the exam they're asking the reason for all these elevations over here. Fine. Now remember, the vagal triangle will be formed by 10th nucleus. The name itself is telling you. Hypoglossal triangle will be formed by the 12th nucleus. The name itself is telling you. Vestibular area is formed by 8th nucleus, vestibulocochlear nucleus. Fine. Vagal triangle is formed by the 10th nucleus, vagus nucleus. Hypoglossal triangle will be formed by the 12th nucleus, hypoglossal nucleus. Vestibular area is actually formed by vestibulocochlear nucleus. Till here, my dear friends, please forget about this one. They will never ask you. Study smartly here. Study according to the mindset of the examiner that यार ये पूछेगा, नहीं पूछा जाएगा एग्जाम में. Fine, because it is there in the name itself. And always for your exam, please remember about the facial colliculus. Now remember, facial colliculus is the one which will be formed due to the 6th nucleus, that is your abducens nucleus. Even though the name is like facial colliculus there, remember it is not formed by the facial nucleus, it is formed by the 6th nucleus, that is your abducens nucleus here. It is formed by the abducens nucleus there, sir. Fine. Now why it is happening like that? When you take a section at this level, you will understand. Fine. अगर आप यहाँ पर एक section लोगे, if you take a transverse section and see inside that, then you'll understand that yes, there will be the 6th nucleus, for example, and then the 7th nucleus. 7th nucleus is more ventrally. So what is going to happen here? The 7th nerve, the facial nerve, is going to take a turn around the 6th nucleus and come out. It is going to take a turn around the 6th nucleus and come out. So because of this turning here, there is elevation formed here, और इसी को तो हम कहते हैं facial colliculus. So facial colliculus is formed due to the 7th nerve taking a turn around the 6th nucleus. तो इसीलिए उसको facial colliculus कहा जाता है. Are you understanding here? Yes. Now recently this question was also asked from here. Yes, after completing every topic, we are seeing the clinical anatomy here, a lot of clinical correlation, as well as the questions asked in the previous year topics. अगर मान लो कि facial colliculus पर इंजुरी होता है, if there is a injury at the facial colliculus, then what is going to happen? अभी मैंने आपको बताया है, अगर यहाँ इंजुरी होगा तो सबसे पहले क्या इंजूर होगा? Of course, what is going to get injured here? It is 7th nerve. So 7th nerve is getting injured here. That is more better answer when compared to abducens nucleus. That is why remember, if 7th nerve itself is gone, yes, what is going to happen? The muscles of facial expression will be involved, sir. Muscles of facial expression will be involved. That is more better answer when compared to lateral rectus. Don't see that there will be abducens nucleus, the 6th one, and answer there as lateral rectus. No. Not the lateral rectus, my dear friends. Muscles of facial expression. And in your exam, risorius muscle was given in the option. Risorius muscle was given in the option there, guys. I hope you'll be able to manage with this one here. So by this, we are actually done with the ventral aspect and dorsal aspect of the brainstem here, my dear friends. Fine. My dear doctors, will actually do one thing here. we'll actually stop the session here. I think I'm not able to manage. We'll actually stop the session here, my dear friends. Unable to manage with the I'm unable to bear with the pain. Actually, it's unbearable now, and because of that unbearable pain, I'm feeling like hazy right now. I'm feeling like hazy. So it's ऐसा लग रहा है कि ऐसे घूम रहा है पूरा. It's all turning here like this here. तो इसको यहाँ पर स्टॉप करते हैं. मैं आपको अपडेट करूँगा. आई विल अपडेट यू व्हेन आई विल बी टेकिंग द सेशन. विल रीशेड्यूल दिस वन हियर ना. पार्ट 1 पार्ट 2 हम दोनों को रीशेड्यूल करेंगे. विल टेक इट इन अ मोर बेटर वे. फाइन. ये पता नहीं है लाइक व्हेन आई विल बी फॉलिंग डाउन. ऐसा लग रहा है कि आई विल बी फॉलिंग डाउन हियर एंड देयर. पूरा ऐसे घूम रहा है अभी. इट्स हेजी. So we'll stop the session here. Just pray for me. Thank you. And sorry guys, sorry for the inconvenience, but for sure I'll come back like more strongly. We will take the session in a more better way. Fine. Fine. We'll actually stop here. Thank you. Sorry.